Mikhail, please take yourself off of mute.
Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Ar-Rahman-Ar-Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta alayhim. Ghayril maghdubi alayhim waladdallin. Ameen.
Ameen. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala rasulillah.
Wa alaikum salam. Assalamu alaikum, dear family. It is indeed an honor and privilege to be with you again. So let us begin with welcoming our speakers this morning, Dr. Constance Shabazz and Dr. Patrice Mohammed. Dr. Constance is the founder of Salaam Community Wellness Center, where Dr. Patrice practices integrative medicine. Please visit the community directory on the Study al-Islam website to read their full bios. Dr. Constance, Dr. Patrice, welcome.
Assalamu alaikum, and thank you so much. We're so excited about this opportunity. So I'm going to take it from here.
Yes, ma'am.
For a few minutes. Okay, Bismillahirrahmanirrahim. Again, my name is Constance Shabazz. I'm one of the co-founders of Salaam Community Wellness Center. And we're located in Chicago in what's called the Woodlawn community. And for those of you all who have some Chicago roots, that is a community where many African Americans came to, migrated from the South, escaping the terrorism that they were experiencing. And it was actually a hub, not only of business and economics, but also it was a hub for healthcare. We had many physicians there in that area many years ago, some notable integrative medicine doctors too. And so, but over the years that area has suffered a lot economically, and as because of disinvestment in the area, we've lost a lot of the key essential services that are needed, including healthcare. So I'm just going to give you a little brief history about us. I'm going to share a PowerPoint. Give me one moment.
And just for all the callers, everyone on the line, we are going to take questions at the end of Dr. Constance and Dr. Patrice's presentation.
Thank you. And so the Salaam Community Wellness Center, this beautiful building, this was actually an abandoned building and had been abandoned for about 6 years. They were running drugs and guns out of there. And actually this 100-year-old building was really slated for demolition. But we had a brother who saw the vision there. To the right here, you'll see a small, which is actually one of his businesses. And he wanted to revitalize the community. And one of the things he wanted to do was actually invite other business people in there to consider purchasing the building. Couldn't find anybody. So Allah blessed him to be able to acquire. This was right at the beginning of COVID-19. And during that time, we were just formulating the Salaam Community Wellness Center program. So we were established early on in 2020 as a result of COVID-19, but not limited to address COVID-19. This came about in response to the high rate of infections and deaths in Black and Brown communities on Chicago's South Side. In one community in particular that is adjacent to Woodlawn, it had the highest number of infections and highest number of deaths, and the second highest number of deaths amongst nursing home residents in the entire state of Illinois. So of course that hit us close to home in terms of what can we do. So our goal was to not just look at responding to COVID-19, but to look at what were these unaddressed or underaddressed diseases and conditions that resulted in these devastating outcomes. These included physical, mental, as well as what we call the social determinants of health, which include things like housing and food insecurity, to name a few. We look at Salaam Community Wellness Center as a movement. It's not a place. Not saying that we don't love our beautiful facility, but we know that where the need is, there Salaam Community Wellness concept will go. And so we're already thinking outside of the box and using this as a model that can be transformed and customized for any community, wherever. What is our mission? Well, our mission is to help build and support healthy communities by empowering them through improvement of health, wealth, wellness, education, and economic development. And we, as a vision, look at this being a premier leader of integrative healing and transformative healthcare model. When we started this, we really started with absolutely nothing but the inspiration from Allah subhanahu wa ta'ala. We had no money, even though our benefactor had the building. We had no physical space, but it gave us time to really focus in on what are the key areas of focus in terms of healthcare that was needed. And we did this against the backdrop of not having access to a lot of data because, the health system was really focusing in on COVID-19. But we were fortunate enough to be able to tap into and talk to a lot of the community members to find out what were the critical issues. And so we narrowed it down to 4 key areas, not limiting it, but these are the primary areas of focus. Culturally responsive primary care, we'll talk about that in a minute. The addictions, we saw that there was an uptick in addictions and overdose as a result of COVID-19. Mental health, it was already off the chain. It just went over the cliff completely. And nutrition, many of the communities, including the one that we're serving in, are food deserts. In fact, the community that we're in had its first full-scale grocery store in 40 years opening up just the year before COVID-19. Well, what is our model of care? Well, first of all, we wanted to not just open up another health center, because as I told the sister earlier, I've worked with community health centers now well over 45 years. So I know that model of being able to provide services to people regardless as to their ability to pay. But we wanted a model that really responded more to what the desires were of our community. We wanted to make sure that we were using both the best of Western as well as non-Western modalities. All of our practitioners have either practiced non-Western modalities and been trained and practiced Western modalities, as well as even all of our board members and other affiliates. We all recognize the power of these things, but the fact that the Western conventional medical model is just now waking up to utilizing these different modalities, we wanted to start day one with them because we knew the impact that it had. And we found through surveys that had recently been done that people in the community were asking for these things. They were tired of going to a physician's office or practitioner's office. And the first thing that happens is that they're writing a prescription for something. They're sitting for a bunch of tests, but not really explaining to them why they're doing this. And the most important thing, not giving them other options. And that's what we want to do. And that's what we are doing, alhamdulillah. So we provide individual and group therapies, deep breathing, meditation, yoga, massage, acupuncture, Reiki, which is an energy healing process, sound and music therapy, things like Tai Chi, Qigong, and the list goes on. So what is our basic core model? Yes, it's those modalities, but is based on respect of the human intellect. And what do we mean by that? When we say respect of the human intellect, we as individuals, we all know when we feel well. We all know when there is dis-ease. And so we have to, as practitioners, recognize that and give the individual the opportunity to be listened to. And that's why I call primary care is really listening to the patient. Now, some people will think, and I know Dr. Ramadan is on it, primary care, the patient presents to you with a complaint or a history, you listen to that, then you try to figure out what's the diagnosis, how am I going to address it? But I say the primary care, the first thing you do is listening. I know in my medical education, the first thing they had me do was actually spend time with patients and hearing about their history. And I have a funny story that my first patient that they assigned me to, it took me 2 days to actually do that complete history because that person wanted to tell me all about their family and their living situation. And now reflecting back, I said, wow, here we are trying to do the same thing because that person knew that that was part of their history. That really explained what their issues were. And it better helped and aligned with me as a practitioner to be able to help them. And last but not least is educating versus dictating. Oftentimes people feel as if they're being told by practitioners what to do instead of being educated about what they do. I always tell to my team, I've never followed a patient home and watched what they eat, how much sleep they get, how I don't go to the grocery store with them. I don't fix their food. But the best thing that we can do is educate them and help them to navigate this very, very, very complex and disturbing at times system that we call our conventional medical system. So here, I'm going to give you a little quick tour of our beautiful facility. We have 4,500 square feet. This is part of the facility that I call this a pathway to health, because this is where our exam rooms are and some of our healing rooms are. This is one of our exam rooms. The beautiful cabinetry there was donated by a Muslim family. It was all custom made. You'll see the exam tables. We were partnering with a medical training facility there in Chicago that recently closed down, and they gifted us a lot of the supplies, equipment, and furniture. This is our laboratory, and we are partnered with a Muslim-owned laboratory, alhamdulillah, after a year of really trying to find the right fit for us. And Dr. Patrice, I'm sure, will share with you about the unique collaboration that we have with them. And this is what we call our multi-purpose room. At what you see right now, this was set up for our Reiki deep breathing meditation session. But we use this room. We have a conference table that we have there typically, and we use it for meetings. We use it for education. Like a couple of weeks ago, a couple of months ago, when there was Medicare enrollment, we actually brought a brother in who works with CMS. And he talked to mostly believers who came in, talked to them about Medicare plan, and really helped people to guide them through that process. So like I said, it's about education. And other things we use it for is massage therapy and acupuncture and other therapies. This is my favorite room. This is what we call the wellness room. And Allah's blessed us to outfit this in a way that aesthetically is just beautiful. You come in here, people can just relax, have just private time. You see the prayer rug there. We use it for Salat. I mean, it's just a wonderful room, and it really, really speaks to what Salaam is all about. Because as somebody asked me, why did you name the Salaam? I said, isn't that what everybody is seeking? Yes, and they got it. And this is one of our trainers. This is Dr. Larry Turner, who is a yoga instructor. He's also a clinical psychologist. And so he's part of our team. And here he's doing a presentation to a group of young people, including my godson, not so young, who's there, who owns the building. And this was a session for young people who are being trained to become community health workers. These are individuals who are going to go out into the community and connect with the community members and find out what their needs are and connect them to the services that Salaam offers, as well as other medical, health, and social service agencies. And this is one of our medicinal yoga, this medicine sessions is done by brother Daryl. And there's a lot of energy here. Really has helped people. We had one woman who came in who's going through cancer therapy, and it really has helped her to be able to weather the chemotherapy that she's going through. And this is actually a demonstration of hand massage, but we do full body massage also. And the sister there is our massage practitioner who's worked with us. And then this is a music therapy. This young brother who's there, he's 14 years old, maybe 15 by now. He came up with an idea of using music and having the music in medical facilities like hospitals, and using it to help to relieve the stress of patients and patients' families, and now even the staff of hospital workers, because they know the stress that people are on. And we did a pre and post questionnaire that they gave to us before we saw this performance. And I would tell you personally, all of the stress points that I thought I had before this performance that they gave, which was about 20 to 30 minutes, but when we did the post, it was all gone. So that just shows you the power of the therapy. And we also are working with a woman who is a neuroscientist at Northwestern University, and she is also a viola player in the Chicago Symphony Orchestra. And we're working with her. She wants to come in and actually do a special music therapy program for people who have intractable high blood pressure. And this is our annex. Excuse me, I mentioned about 4,500 square feet. Well, the first area you saw was 3,300 square feet. And this is our annex. This is what we're going to expand into to continue expanding on our both our physical and mental health services. We are in partnership with a young woman who has done a dynamic job in terms of creating a model of mental health that is affordable, using both the Western as well as non-Western modalities. And we'll probably be using some of this space. What you don't see is two exam room size rooms to be able to provide more services to the community. And this is the beginning of our Paradise Garden. Back in the early spring, late spring rather than early summer, we planted about 25 or 30 raised beds, organic garden. And so this garden grew anywhere from 25 to 30 different varieties of organic fresh fruits and vegetables. And it was wonderful. It was wonderful that the members of the community could just walk into the garden and pick up things. I jokingly said to one man as he was loading up his garbage bag with fresh fruits and vegetables, I said, look, when you get something garden, you prepare that food, bring it back. You got to bring it back so we can taste it. And he stopped for a minute. He didn't realize that I was joking, but we wanted to be accessible to people because, as I mentioned, this is a food desert that we're living in. And even that grocery store I mentioned is at risk of closing down because it's part of this big merger among some of the big grocery store conglomerates. And recently lost a Whole Foods in an adjacent community with low income. So you understand that they don't really care whether or not we are getting sustainable food in our communities. They're just worried about their pocketbook. So we have to do for ourselves to make sure that we have fresh fruits and vegetables available to us, because many of the modalities that we are promoting and practicing are dependent upon good nutrition. And this, I had to show this. This is like my wild vision for our Paradise Garden. This was done by an architect. And so also I want to show what it's going to look like on the inside. I'm sorry, maybe I didn't. Okay, here it is. Okay, and I'll go back to and as you can see, those beds there, those will be raised beds, as well as we'll have the hydroponics that'll be going vertically. And I want to point out this community gathering space, because we call this a holistic healing space, where we will be able to, in that beautiful space, be able to do some of these modalities. People will be able to come in there, they will be able to pray, they will do deep breathing, meditation, yoga, and the like. So we're really excited about the future of that. And so this is also part of our future. We call this the miracle on 67th Street, this renovation, this revitalization that Allah subhanahu wa ta'ala has allowed us. And I wanted to just point out to the left, those are two actually 4 retail spaces that we're in the process of acquiring. And on the second floor, we hope to have affordable housing in this community that's rapidly gentrifying due to the fact that there's the University of Chicago, which has been encroaching on the area, as well as the Obama Library. To the left of that building, you can see an open space. That's an entire block. And inshallah, we are going to acquire that block. And inshallah, we're going to build a state-of-the-art facility that addresses many of those social determinants of health, from zero to death, because we need it in that community. Inshallah, we will do that. And so, so this is our some contact information about us. I'm hopeful that Sister Fitrah will be able to post that on her website. Our website is salamcwc.org. We are a non-profit organization. We're 501c3, so we accept donations, and that has kept us afloat. We do accept insurances, and we have affordable payment plans, because we know sometimes, even for people who have insurances, that co-pays and deductibles are so high that you might as well say that they don't have coverage. So we are going to make this accessible to everyone in the community. And like I said, we don't look at this as being a space or a place. We look at this as being a movement that, inshallah, that we're going to be able to share with other communities. And we're already in discussion. Sister Fitrah, I didn't tell you when we talked earlier, just last night, we're in discussions with some people who want to do this nationally and maybe even internationally. So inshallah, we want to make sure that we do our due diligence to establish this. We also are going after federally qualified healthcare center status, which will allow us significant funding to take that financial burden off of us. But also, it does not force us to abandon this beautiful model that Allah subhanahu wa ta'ala has blessed us with. So thank you. May Allah bless each and every one of us and keep us in your du'as. And at this time, I'm going to turn it over to my esteemed colleague, Dr. Patrice Muhammad, and I'm going to let her introduce herself and give her background and talk a little bit to you about what is integrative medicine. Assalamu alaikum, my dear sister.
Wa alaikum salam. Thank you so much, Dr. Constance, and thank you, Sister Fitrah, for having me. I am honored. My background, very basic. I graduated, and well, as Sister Fitrah said, you can get a full picture, or a more picture, I should say, of my background on the Salaam Community Wellness website. But I am a physician associate of about 29 years, graduated from the Cook County Hospital Malcolm X College physician assistant program in 1994, and had gone on to Capital University of Integrative Medicine, where I received my PhD in integrative medicine, which is really my joy in particular, because it does allow a person to work on, it allows a practitioner to work with the whole of a patient. And with that, before I get started, I'm sorry, I want to go back just 1 second. Dr. Shabazz, you didn't show them the big comfy chairs in the wellness room. We are very proud of this, and there's two big comfy chairs in the wellness room where you could literally sit back and immerse yourself a little bit in comfort. So I just wanted to point that out. Okay. All right, so I'll get started. Let's go through some terms first, and I want to share my screen because I'd like to go through some terms, because many people have questions about what is integrative medicine, what is complementary medicine, what is allopathic medicine. So you see, this will stop sharing. You want to continue? Okay, and so as soon as Dr. Constance has her screen, stopped her screen sharing, then we can move on.
I've stopped.
Okay, all right. So now I will share my screen. Okay, there we are. So let's go through some terms. Alternative medicine is a term that they use, which encompasses a wide range of medical practices and systems from cultures around the world. And of course, in the countries of here, United States, and people describe practices that are outside of mainstream medicine, which I would say is, we'll see that later, but traditional Chinese medicine. So that's one that's mainstream, of course, outside the United States. The complementary medicine term, and you'll see these pretty much, they all mesh kind of together, as you'll see. The complementary medicine is the term used to describe types of treatments you may receive along with traditional Western medicine. And the examples is massage, meditation, biofeedback, as Dr. Constance pointed out, Tai Chi, Reiki, music therapy, guided imagery, and dietary supplements. And now you have integrative medicine. So integrative medicine, and you see that they'll start to kind of mesh together. It's a healing-oriented medicine that takes into account the whole person, including all aspects of lifestyle, the physical, emotional, mental, social, spiritual, and environmental factors that influence a patient's health. And it emphasizes the therapeutic relationship between the practitioner and the patient. And it integrates its wide range of modalities with conventional medical practices and technologies to treat acute or chronic conditions. And that includes, and this list is not exhaustive by any means, but some major areas would be nutrition, and that's special diets, the dietary supplements, herbals, and probiotics, the physiological, which is the mindfulness and the deep breathing. Physical is the massage and spinal manipulation from either an osteopath, from a chiropractic or a naturopath. And the combinations with the psychosocial and physical, which is yoga, tai chi, acupuncture, dance or art therapies, and mindful eating. So you see that there's a great overlap in those terms, but the difference in the terms is now you get into allopathic. What is allopathy? So allopathic medicine, also called allopathy, it's a health system in which medical doctors, nurses, pharmacists, and other healthcare practitioners are licensed to practice and treat symptoms. And by treating symptoms, they use remedies such as surgery or drugs that produce different effects from those caused by the disease. And then you have osteopathic doctors. And osteopathy is similar to the allopathy model. However, a major difference is that osteopathic medicine, they use manual medicine as part of their treatment. So they include a lot of work, hands-on work on joints and tissues and massage, okay? All right, so in that regard, I want to go into the area in particular that now at Salaam Community Wellness Center, I actually offer primary care services, but in my own telemedicine practice or telehealth practice, I actually offer integrative medicine. And this is the component of integrative medicine that I focus on, and it's called nutrition response testing. And nutrition response testing, let me just go back, hold on. Okay, so in nutrition response testing, that is a study of how the different points on the surface of the body relate to the state of health and to the flow of energy in each and every organ and function of the body. Since human anatomy hasn't changed significantly in thousands of years, the utilization of these reflexes and specific points have become extremely useful in our practice because they are so accurate. So I have a demonstration so I can kind of show you what that looks like in a minute. Here we go. Let's see if this demonstration will play.
Dr. Patrice, you might want to see if the mute button's on the video.
Okay, 1 second. Okay, I'm sorry. Go ahead.
No, yeah, or the volume. You might want to check the volume. I see it's not muted, but you might want to check the volume on it.
Thank you. Okay. Let's see. See if I can.
Let the video keep going, and Dr. Patrice, you can kind of explain what's going on, but we can visibly see the doctor because we're going to be short on time. So let's keep the video moving and you explain it.
Okay. So they're using a technique. 1 second. They're using a technique. Oh, I'm gonna cut that. They're using a technique again that I mentioned, which is called nutrition response testing. So it's like muscle testing. Most of you all know about muscle testing. And so that takes into consideration the meridians of energy, and each NRT reflex or nutrition response testing reflex represents a specific organ, tissue, or function, and it indicates the effect that the energy or lack of energy is having on the body. So as they're doing the testing, as I do the testing, or a practitioner does the testing, if there is an organ that is deficient, or it's not producing the function of that organ well, it will spill out its proteins. And when it spills out its proteins from that particular organ, there will be like a short circuit of that energy. And so we can directly pinpoint and identify the particular organ that's affected. And so then there's a personalized program that we give everyone for that, okay? And then I wanted to, do I have about 5 minutes?
You do.
Because I'd like to show this video in particular, because this goes over some music therapy that Dr. Constance mentioned. But the design, I'll just bring this point up, the design clinical nutrition program, and that's just whole food supplements, as we mentioned in the previous slide, that they're whole food supplements as well as herbals, as well as probiotics. All of these go into a personalized program for a patient once the nutrition response testing is completed. Okay. Now, this is acoustic therapy, as Dr. Constance pointed out. This is being used, and very successfully being used, as a modality to help diminish stress, diminish and bring down stress levels that cause, that can lead into high blood pressure. It can lead into strokes, heart attacks. So this is extremely important, that we help calm the inner being of a person and to help them to cope better. It's only about 4 minutes.
Yeah, the audio sister is not working, so if you can just summarize it.
Oh yeah, he's talking about, I'm sorry.
Sister Patrice, we have callers on the line, so if you could kind of explain what's going on, because some people are not on Zoom.
Okay, so this is, let me turn this down a little bit so I can hear myself. This is a company called Music to My Ears. Started off to help diminish stress, and it was started by Ray Muhammad, a PhD in sociology, and his son. And he's just describing the areas that are needed, in particular, again, the COVID-19 impact caused a lot of people to think outside the box to help. And they are coming, well, his son is a musician. He plays the violin. And so there are other musicians that came together in a concerted effort to help. And I just want to just play a little bit of that, and I'll be done. I wanted to play a little bit of the selection so you can feel it. Okay.
Sure.
Okay, here we go. Where are they? Okay, here we are.
And that was at the Salaam Community Wellness Center in our multi-purpose.
Okay.
But unfortunately, your computer is not sharing the video audio.
Hold on, let's see. Oh, it's not showing the video audio? Oh, wow.
It's moving.
Let me see if I keep moving, see if it'll come up. Okay.
Right there.
Okay. All right, thank you. So I wanted to bring out 2 points in particular, and that is nutrition response testing, very, very, very specific on pinpointing the problems within the body that the person may be having, as well as acoustic therapy. It's a very proficient, effective way of reducing stress, which in return can diminish high blood pressure, the incidence of stroke and heart attack, which are very significant. And it actually is a part of mindfulness because it helps to open you up. It helps to relax yourself, and it causes you to increase your creativity, because if you're not so stressed and you're relaxed, then that'll increase your activity, your productivity. It will increase your work performance. And so those 2 components in particular, we're working at the Salaam Community Wellness Center. And I'm very, very proud to be a part of the new movement of healthcare.
I want to thank you. Oh, no, I want to thank you. If you could take your screen down.
Sure.
I want to just say to the listening audience, please, if you have any questions, send them. But I do have a question. First of all, having you on to describe the services that are at the Wellness Center are much needed. I'm very interested in the integrative medicine. So what type of insurances do you take? That's very important to, I'm sure, everyone who's listening.
Well, we take the most common ones that are, because insurance is really related to the state that you're in, okay? And so we have like Blue Cross, Blue Shield, Aetna, but what happens for anyone, if they are not assigned to that insurance in the state where the care is provided, then it would be considered out of network. And so as far as the insurance reimbursement, they may not be willing to reimburse to you to the extent that would be financially comfortable. So that's why I mentioned before that we have these payment plans. We do some discounted plans because we want to make sure that everything is affordable. And if we determine that someone just cannot afford the payment at all, that's why we're a 501c3. That's why those donations are key, because it helps us to offset our costs. We may be able to discount the service, but we can't negotiate the lights, the heating, the rent, so we try to make it affordable to any and every person.
Yeah, we understand that. I just wanted to make it very clear on, that you do take insurance, because many holistic facilities don't take insurance. So that I wanted to just clear up, and whether, whether the insurance will pay for the service or not, I'm sure that you will communicate that to the patient.
Yeah.
Let's move on to the next question I have. So you do provide telehealth services, which is done via Zoom. Is that correct?
Yes, Dr. Patrice can respond to that. Go ahead.
Yes, right now I offer that as part of my company, which is Health at its Best. And so now that, on the other hand, I do not take insurance for that, because that is not reimbursable. As we've been pointing out, we're behind the times with them reimbursing for natural and alternative healthcare practices. But we will be offering that at the Salaam. That is another service that is upcoming to the Salaam Community Wellness Center, though.
Okay. And we do some telehealth visits right now, again, but still subject to the same payer sources that we discussed.
Can we recognize Brother Fleming to ask his question? Please keep it brief. Hold on, Brother Fleming. Can you take yourself off mute, Brother Fleming? Okay, you're on mute. Go ahead. Keep it brief.
Thank you very much. I was wondering if Dr. Terry Mason was a part of your associates at the facility.
You mean Dr. Terry Mason? Is that who you're talking about?
Yes.
No, not directly. We know Dr. Mason very, very well, but we don't work directly with him.
And
Thank you very
so, I'm sorry. Do you have any other questions, Fleming?
Too much history involved. We'll go on. I'll be quiet.
Okay. And so,
But one comment I want to make, obviously, because medicine, the field of medicine is so broad, oftentimes people will come to us with questions about different modalities they're using or interested in using, or herbs or vitamins. And, as well versed as our team is, there are many things that we're not familiar with. But what we do is, one, as I mentioned before, educate people as to, and do some of the due diligence in terms of researching to be able to advise people. And another thing we do is we monitor them, getting baselines on how your kidneys are functioning or how your liver is functioning, which are, these are the big filtering and detox centers, and monitoring these therapies so that we know that at least that it's not, whatever these modalities are not harming your body. And so this is a big thing that we really will promote to each and every one of you all, because everybody's going to tell you, well, this works, but you have to take in consideration your body type, the fact that you may have different conditions or different therapies or medications or taking foods that may interfere with these things and actually make your conditions worse.
We have another question. I want to keep these brief because we do have questions. So do you accept patients that are out of state? Also, can individuals with a chronic illness travel to Chicago to stay in the city for 3 to 6 months to receive treatments at your facility? And I want to say, keep it brief because people need to follow up with you after this in order to get more extensive information. But go ahead, Dr.
Well,
Constance.
yes and yes. But I mean, many of the things that we're doing don't necessarily require someone to physically come to the health center. We're using modalities that can actually be done in your home, in a sense, and we monitor them. So yes and yes.
Excellent. So they need to follow up with you. They need to call you. Just so you know, to your question, Dr. Constance, this video will be played for an entire week. It goes into the newsletter on Saturday, and it will stay in the newsletter for a week. So everyone can revisit it and listen to it, and then it would be archived on the website, on the Study Al-Islam website, and they have access to it.
So to let you know, I am putting our website and our phone number in the chat. Okay.
Yes. Do you enable health in New York? Do you take Emblem Health in New York?
No.
Okay. Mm-hmm. Do you have Dr. Terry Mason? Oh, Dr. Fleming. I mean, Brother Fleming asked that. So are you providing services to other cities that may want to duplicate this facility? Would you, do you have the staff and time to support cities who might want to open a healthcare center?
Well, I am a healthcare consultant. That's my line of business, and that's what I'm bringing to Salaam Community Wellness Center, my expertise. And I actually provide consulting work to other health centers around the country. So yes, we do that.
Wonderful. You do take Medicare?
Yes.
So that's one of the, so I see people are asking that. So my next question to you, because I'm very interested in integrative medicine. That's like, so so a person would have to visit the facility in order to receive integrative medicine treatment or diagnosis. Is that right, Dr. Patrice?
Yes, ma'am. They would have to visit the center, because that is, although I do some telehealth, but most people have significant issues. So we want to see them in person. We, those things, I mainly only take nutrition leads that want to do telehealth, that want to kind of shape up things a little bit. But if you have some significant comorbidities, chronic medical problems, yeah, you really should be seen in person for that.
Okay, so I'm going to go back to original question, and I'm going to let you, I see Dr. Constance wants to say something, but let me go back to an original concern. If a person needs to come to Chicago, you know that hotels are extremely expensive in Chicago. What type of, are you looking into maybe places where they can stay with the communities, or available facility, or I want to be a little more specific about that.
Mm-hmm. Well, I want to add something that, typically what Dr. Patrice is talking about, typically we want to see that patient, because there's so many things that we cannot see through telehealth, telemedicine. You want to have that physical exam and do those baseline studies. If, like, for example, though, we determine that there's a therapy that person is going to be started on, or let's say we're weaning them off of medication or whatever, then some of those follow-up visits could be done through telehealth. Okay. So, but back to the issue around if somebody comes and even just for that initial visit, we haven't gotten that far, although, we mentioned in the presentation, my part of the presentation, about that housing that we are trying to do. Right. Actually, above the health center, we have a beautiful 3-bedroom apartment, which we originally were going to do it as an Airbnb. So there's still some thought about doing that. And we have actually 3 other houses behind us that we are renovating, either for transitional housing or for individuals who are going through substance abuse. And so you put a kernel in our mind in terms of, having some kind of space for people who would want to come or need to come to Chicago to have therapy. So thank you for the idea. We're definitely going to put that on the table.
I do know that when the Atlanta schools opened their schools up to our national community, that was one of the issues, but they did find ways, and there were families. So it is possible. And I do want to encourage you, because there are people who are going to want to come to Chicago to have that initial visit. So I just want to encourage you to do that. So what are some of your treatments or your initial diagnosis or exams regarding cancer? And I know that we have lots of we have blood pressure and all kinds of diseases in our community because we've gotten away from how to eat to live. But cancer it just seems like it keeps coming up again and again and again, especially with women. I know men suffer from prostate cancer, but so tell me a little bit about that. Where are you with that?
Dr. Patrice, you want to start, and I can end up with that. Mm-hmm.
Oh,
because
sure.
Actually doing, yes, and tell them a little bit about what you're doing as far as prostate cancer.
Okay, well, for cancer, first, of course, we have to know what type of cancer the person is diagnosed with. And yes, there are some lab work studies that we need to do, as well as some imaging. And sometimes people, they may come to us, patients come to us with some imaging and some initial baseline studies done that need to be looked at again for a second opinion. So the program, of course, is specialized and individualized to that person and what type of cancer. Women, of course, we have reproductive cancers, and then we suffer cancers that are non-specific, like lung and lung cancer, multiple myeloma. So there are other cancers that are non-specific. So again, I can't stress that enough. It's individualized on what type of cancer, because there are different tests and specialized tests that need to be ordered, so that we can track the level, their staging, I should say, the staging of how severe the case is. As far as prostate cancer in particular, I'm working on research for prostate cancer of African-American men or men of African descent in particular. There aren't enough studies in that area, and we're working on that. And we're looking at some urinary biomarkers that are novel, that are new, that may be better for the African-American man versus other ethnicities or races. So that's what we're working on now.
Let me ask this question. Are you open to, for example, if I get an exam in LA and from a very good doctor, and I get the results, can the service provide continuation of medical care? Meaning, can I take those results and send them to you, and then you provide a care of treatment for me?
Absolutely. Absolutely. We do that. Actually, we see people who have been somewhere else and then they come to Salaam and they're like, oh, can you look at this? And we have to order other labs that have been done. We have to get the results. Mm-hmm. So yes, we do that all the time.
So those labs that you order, Sister Constance, just one second. So those labs that you order, can they be done at a facility where I live? Because you are a doctor.
Sure.
Yeah.
Well, we can, I'll put it like this. I can't order labs for a different state unless I have a license in that state.
Okay.
Okay, so because that's practicing medicine. So I have 5 different licenses in different states, but I only have 5. So so we got 50 states. So no, I can't order labs for you in LA. I don't have an LA license. However, I can prescribe nationally. I can send a medication in, but I can't order labs.
Well, let me just say this to you. I have such good relationships with my doctors. Anything that you order from me, I can get them to prescribe, and then I can bring it to you because I trust you.
Oh, alhamdulillah.
Dr. Constance, please.
Well, no, yeah, and there's there are limitations, but there's also fluidity. I mean, the first thing that we do oftentimes is ask, are you seeing a physician, and when have you last had certain labs? And we can transfer that information, and review it. Again, it's like, what can we do based on the limitations of our license? But I mean, so much of what we do is advisement. You know what I'm saying? Giving people information so they can make those decisions. Because oftentimes when we think of cancer, the first thing that you think of either is going to be some radical surgery, or it's going to be chemotherapy. And so a lot of people are very leery of even, and I'm going to say this, before we even get to the diagnosis, one of the challenges that we have in our community is just getting the screening test. I spoke to a brother recently who kind of hemmed and hawed a little bit about, oh yes, I saw a doctor recently, and was a prostate doctor. And I said, well, brother, okay, so when they did they do the test? And he said, yes. And I said, well, what was the result? And it was sky high, but he says, okay, but I feel fine. And so, but we know that, you can feel fine with something and have something that's actually deadly. And so our thing is to try to, like with the program that Dr. Patrice is working on, making it as easy as possible, financially accessible in terms of transportation and availability in the community, and also the least invasive way to do either the diagnostic testing and the like. And the other thing about our model is that, yes, it may not be feasible to replace, if you will, the therapy, but there are ways in which, that's where the term complementary comes in, where there are other modalities that help to mitigate the side effects. And that's what really people are concerned about, that the treatment oftentimes is worse than the disease.
Okay, and I want to come back to that, but someone is asking a question. Dr. Patrice, what are the 5 states you're licensed in?
Oh, Iowa, Illinois, Indiana, DC, and Maryland.
You're licensed in DC?
Yes.
Oh yeah, well, guess what? You got a patient right here. No, I'm calling you after this. I know a whole bunch of people in Maryland are going to be calling you as well. Dr. Constance and Dr. Patrice, there's nothing greater than the trust in your medical care provider. I don't think there's any, I often say people will give all their money away to have good health. That's probably the only thing that we would give away our money for is good health. So having the 2 of you and having others, it is so critically important to the health of this community. And I just want you to know how much we appreciate the Muslim Health Consortium, the Salaam Wellness Center, and all of the doctors in our community that are dedicating themselves to caring for our health. We're going to have to close. I'm going to give you Dr. Constance very briefly. Dr. Constance in another life was one of the ministers in the Nation of Islam. She's got a wealth of knowledge. Wait, before you say anything, I see Dr. Ramadan. He wants to say something. Please, Dr. Ramadan.
Yes, thank you. Assalamu alaikum.
Alaikum salam.
I just want to say that I am so proud of this development of the Salaam Wellness Center, and that it was indeed my honor to work closely with Dr. Constance over 50 years ago when we worked together on the Honorable Elijah Muhammad Memorial Health Facilities Corporation. And at that time, the direction was towards building a hospital, but many of these concepts that she's now brought into existence were being formulated. We were thinking along these lines at that time. And our paths separated since then, and always I've been a strong supporter of it, and she knows I was there always in spirit and still there. And I'm just so pleased and thank Allah to see this development, and looking forward to great things in the future. So
and just for all the listeners, Dr. Ramadan is the chair of the Muslim Health Consortium, which is a collection of doctors in our community in all fields of science, and our advisors to our community were advisors and are advisors to our community regarding COVID and how our masjid should function, and so we need to call on them. And Dr. Constance, we at our very last minute, I want to give you a moment, and to Sister Patrice to just give a brief closing comment.
Alhamdulillah, alhamdulillah, alhamdulillah for this opportunity. Thank you. Thanks a lot for this opportunity to share. Sister Fitrah, thank you for all the great work you're doing. Dr. Ramadan, we've been in the trenches a long time. Dr. Patrice, love you, sister, and that's it.
Thank you. Dr. Patrice, please.
Thank you for the opportunity and the honor. Look forward to another one. Thank you. Love you too, Sister Dr. Constance. We've been with each other for quite a long time.
Yes.
Thank you. Alhamdulillah.
Inshallah. Yes.
We are honored as a community to have this kind of scholar available to us. We see it in every other community, and we often can recognize it. We often talk about how the Jews are so united, and we talk about how the Christians do. Well, the Muslim African American is following the same kind of path that Allah subhanahu wa ta'ala wants for us and that is we have scholars in our community that we can go to, and I cannot tell you that I am so blessed and grateful to have lived long enough to see this. So in our closing, I just want to say to mark your calendars, because Study al-Islam will take a short break from March 1st to the 22nd to prepare for Ramadan 2023 and Life Topics 2023. Let me repeat that. We are going to take a short break from March 1st to the 22nd to prepare for Ramadan and Life Topics 2023. We are planning an exceptional lineup of speakers and topics to further educate and support our individual and collective community journey, inshallah. Make sure to read the Study al-Islam newsletter to stay updated. It's coming out every Saturday. If you are not receiving the newsletter, please visit the Study al-Islam website and subscribe. If you are if you're able to donate to Study al-Islam, please donate to keep Study al-Islam growing. So until we meet again, remember Allah created in us sensitivities that give us the ability to declare justice, recognize truth, feel kindness, mercy, empathy, and love towards one another. He created beauty all around us, proof of his existence, proof of his power. Remember, verily, those who say, our Lord is Allah, and remain firm on the right path, on them shall be no fear, nor shall they grieve. Your sister and friend, Sister Fitrah, and Dr. Ramadan, I'm going to ask you to close us in prayer, please.
Bismillahirrahmanirrahim. Allah sir. Inna al-insana lafi khusr. Illa alladhina amanu wa amanu solihat. Wa tawassaw bil haqq wa tawassaw bis sabr. Ameen.
And just so you know, next week, we're going to deal with a very sensitive issue, and it's important that we deal with it. We're going to deal with polygyny. And I've asked Imam Fahim, who will come on and talk about polygyny from the Quran. And I've invited Sister Rama, who is a member of our community. She is the director of Karama, which is a group of Muslim women. She is unable to be with us, but she has recommended another sister who's a member of our community, attorney Aisha, and we will be talking about the legalities of polygyny here in America. It's a difficult topic, but I know that we are venturing down that path, and so we need to discuss it because we need to demystify it, and we need to make sure that if those who want to practice this are doing it correctly, and that the sisters understand what legalities there are, whether they're protected in this. I'm not advocating for or against it. We know what Allah says in the Quran. So Imam Fahim has agreed to be with us, and we will have an attorney to address the legalities of this, so that you all out there that think you're protected and you're not, we need you to know that. May Allah bless you all. And inshallah, I hope to see you next Sunday. Thank you, thank you, thank you. Assalamu alaikum.
Like